I can't,
All right. At this time, I'd like to call to order the meeting of the Stokes County Commissioners for Monday, October 24th, 2022, and Commissioner Barncastle will lead us in the invocation if you'll stand.
Heavenly Father, we come to you today, Lord. Thank you for your many blessings. Thank you for another day of life. Thank you for another beautiful day. Lord, bless us as we go with us and conduct business with the county. Be pleasing to you and to the citizens. We pray for all the sick and injured in our county, and especially our military people that serve us to give us the freedom we have today. In Jesus' name, amen.
Amen. You remain standing for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, at this time, I'll look for an approval of the agenda. Are there any changes to the agenda or anything? If not, I'll entertain a motion to approve the agenda.
Moved. Second.
All right, all in favor?
Aye.
All right, at this time, it's public comments. Did anybody sign up? There's nobody signed up for public comments, so I'll move to the comments from the commissioners and the manager, and we have Andy Nicholson and Commissioner Mendenhall on the speaker phones here that couldn't be here today. So go ahead and start with Commissioner Morris.
Thank you, Madam Chair. I'd just like to welcome everybody either online or that are here in the room for participating with us today. We appreciate your presence. That's all I have.
Commissioner Nicholson, do you have any comments?
Yeah, thank you, Madam Chair. I'd like to say I apologize for not being able to be there today. I had a 65-year-old, did not find anybody to watch her. My wife had too much of a full schedule, so I do apologize for not being there, but do appreciate your patience with it. Thank you, Madam Chair.
No problem. All right, Commissioner Mendenhall, do you have any comments?
Yes, Madam Chair. Can you hear me okay?
Yeah.
First of all, I'd like to welcome everybody that is at the meeting and also everybody that's tuning in on YouTube. Thank them. And I also want to give out a special thanks, Madam Chair. My wife had to be transported to the emergency room Saturday morning, and the EMS service did a great job getting here quickly and transporting her to the hospital. And she's back home now, but they did an outstanding job, and I just want to give out a special kudos to the EMS department.
All right. Thank you. All right, Vice Chair Barncastle.
And reiterate some of what they said. Great to see each and every one of you here today. Like I said, that's a beautiful day. You can be outside doing anything but sitting in here. So it's great to see y'all.
Yep, I'd like to welcome everybody and thank you for being here and thank you for watching online. And we will definitely keep Lindy Mendenhall in our prayers, Ronnie, and hopefully she'll get along good with that and get better soon. And it's a beautiful day, beautiful drive over here. I think October's my favorite month to come to Danbury for sure. And the leaves are beautiful, and it's such a beautiful day. After seeing snow this past week in Indiana, I'm pretty psyched to see 75 degrees again. So that being said, I want to welcome Kara here with VIA. It's exciting to get an update from VIA today, health update, and talk about some things with the committee. If you'll just hang on 1 second, I'll get to the information agenda, but I'm just welcoming you here and letting people know that we have an update coming up from you.
You ready to talk?
Yeah, exactly. All right. I'll turn
to you, but not yet. No, I am glad that everybody's here, of course. Welcome to everybody, and I'm glad to see Kara here. I was in a meeting today at Forsyth Tech, and they were asking about VIA and kind of where you were with things, and I let them know you were doing an update. So they'll be watching as well to see what's happening with VIA and the county, and appreciate everybody being here for that. So other than that, thank you for being here.
All right. At this time, I'll read the conflict of interest statement. Before moving any further, does any board member have a conflict of interest with any of the items on the agenda today, or one that could be perceived as a conflict of interest?
Madam Chair,
Yes.
I do. on discussion 7F and action 8A. I have a personal connection through that, and I've talked to our attorneys, and they have asked me, recommended that I recuse myself from that. So it's 7F under discussion and action item 8A.
Okay, thank you, Ronnie. All right. That takes care of that. The consent agenda has the minutes, the budget amendments, and the 2023 holiday calendar. Does anybody have any questions about any of those items?
Just one, Madam Chair. On the microscope that the health department's purchasing, is that like with, we call it CARES Act funding or something? Okay. Okay, good. That's all I need to know. That's it.
Any other questions? All right, then I need a motion to approve the consent.
Motion.
Second.
All those in favor?
Aye.
Aye. All right, now we have the information agenda and our VIA health update. So welcome, Kara Townsend.
Thank you. Nice to be here. I'm Kara Townsend Donor, and I'm always happy to be in Stokes, and it is gorgeous. What a beautiful drive up today from Guilford County. I'm your neighbor, but anyway, I wanted to give everyone an update on what's going on with VIA and how we're performing in the county. You can just see some stats that we have to report on to the state. So this is just a quick, some graphs on Medicaid and non-Medicaid for the members we serve in Stokes County. You can see that mental health is the main group that we serve here, and SUD is substance use disorders, and IDD is individuals with developmental disabilities. And this is another slide, just to kind of show you a little more of a breakdown of where we use most of the services. So outpatient is the largest, and that can be telehealth as well. So that's a big use for us. And I will mention a couple of these. I'll point out a few of these. So innovations, that's the innovations waiver. That's something that people can apply to be on to receive care for really their lifetime. It helps people live independently and not live in a facility. So it's a really amazing thing. Unfortunately, there's a long waiting list. So if you ever know of anyone who could possibly use those services, I would reach out, because they could be on the list for a decade or more. But once they get on it, it really is wonderful.
Are they mental health services?
Yes.
Okay.
It's mostly for people who could not live on their own
Okay.
without assistance.
For whatever reason?
Yes.
Okay.
So we have a wonderful case in Chatham County where a gentleman got on a young boy who got on the list, the waiting list, and now he's 23, he's living on his own, he is on the spectrum, but he has a tiny home, and it's very structured, and he has care from VIA that comes in and makes sure he takes his medicine, and he has meals and he can prepare himself. So it really is a cool thing to see. So definitely some success there. And you can see this is non-Medicaid, so this is the state, that funds different people that are not either, anyone could be on this list. People who don't have insurance could be on this list. It just depends. And so I just wanted to show you the top 5, I guess we'll focus on, just to show you where the most used, I guess the providers that Stokes County uses the most. And as you know, it's Daymark, and you can see kind of the other ones down there from Medicaid services. Here is a little bit more information that you could read later. I won't read it all out to you on the innovations waiver. And thankfully, the legislature gave us more slots in this last year to add to that list. But it's pretty long, like I said, but it's definitely worth it when you get on. And while people wait, they can receive other services, like respite services for the family if they need some help, and also education and finding employment. So there are a couple things that people can get access to. This is just a quick slide to show you mental health, Medicaid, and where we're falling with the different quarters. Sorry, talking close, I think.
Well, we're trying to make some adjustments to the microphones because online, I think people are having some trouble. So it's not you, it's us tinkering with it, sorry.
Do you want me to wait for a second?
I texted, I think, so I'm not sure.
Okay.
It's full battery, so.
I got a note that says no video also. Is that true or somebody?
It's on, but I don't know.
I've got the video pulled up, the video's working.
It is working? Okay, good.
I think
Yeah, it's working.
It's just gone because it has full battery and then it just goes red. Let's try this. Let's try that one time. Yeah, the battery.
I don't think there's any.
There's usually some up here.
Any. Except that.
Yeah, Linda will grab some. It's just
Oh,
just a second. And
yeah,
then,
no problem.
technical difficulties. I don't know what's happening.
Seems like the last couple meetings we've had, some, either the mics or the video.
It says on the screen it's streaming and recording, but I don't know why it's not. Oh, we're waiting on it. And I think it's in the video. They're able to see the video. We have mixed reports on that.
Sometimes the video is not our fault, it's the other end as well. So,
Yeah.
I'm gonna turn it back down because I don't want to blast everybody out. Starts in. It was reverbing like it was
Right.
trying to put it on the normal level with the other.
Okay.
Sorry.
No, it's no worries.
Get it together. That works.
Testing. Can you hear me? Does it sound like it's on? Okay.
We can hear you.
Okay. All right. Well, we can go to the next slide. Y'all have had time to read this one. So this is substance use disorder, admits to the community hospital. So that's pretty much stayed the same. It's gone up a little bit with Q3, but most of these numbers will stay the same in going into tailored plan. And just to remind you, so tailored plan, so we have the standard plans, which is United Healthcare, Blue Cross Blue Shield, and then you have the MCOs. So the state decided that we needed whole person care, and so we are going to be doing physical health, and they are going to be doing mental health. So a lot of members will switch, but we will take care of the most acute patients still, just because that's our expertise. So just to let you know, these numbers will probably stay pretty similar. And this is just a quick slide to show after discharge what the rates are. It's gone down. And emergency department admissions. And you can see, just to let you know, so with quarter Q4, just say Q4, that was cardinal. And so you can see like maybe a difference in VIA. So the next thing I want to just give you an update on the Child and Family Improvement Initiative. That is, you all were gracious enough to send a letter to the state for that because it really makes a difference between a regionalized plan and a state-run plan. The MCOs got together and wanted to make sure that care was more seamless for people experiencing mental health crisis or children in foster care. So what happens is if a child is, for example, in Danbury and their family transfers to Wilmington, the care will go with them. There won't be a lot of, breaks in their care. It'll be seamless, even though they go to another MCO. So we wanted to make it better on children and families and have a standardized plan. And it'll also make sure that people are supported in crisis as well, and also getting health care benefits, making sure they have dental care and other things like that. And this is something interesting. So we are really working to expand our therapeutic foster care parents. It's been really difficult because foster families have some say in if they take a child or not. And the state has noticed that we need some more, I guess, training. So, for example, foster parents for the county, the difference is with therapeutic foster care, they have to take, I think, 6 more hours of training. So we've noticed that might need to be adjusted. And also training families on how to be foster parents so they'll be successful, because it is very hard. I think one of the issues that North Carolina has is somehow we've become an institutionalized state in terms of foster care, in terms of caring for children. So we really want to work on expanding those foster families. And we're doing that by increasing rates, but also I think training will be a part of that eventually. And I wanted to kind of mention some things that we're excited about. So one of the promises that VIA made was helping the county establish a executive substance use committee that would take county leaders, community leaders, people who work in this field and deal with addiction and an overdose every day, to get together and work through issues and really make recommendations to the county on what they see as the gaps and solutions to those problems. And I just have to thank the county commissioners, because I think Stokes County is very special in that everyone sees the problem of addiction, whether that's been through a family member or through, a professional connection. People have been around it, and you understand that it's a serious issue. And I think we're really excited about what's happened with the Substance Use Committee. And we have just transitioned it over to county leaders. So we are attending and helping facilitate some things, but it is really run by the county. So that's an exciting thing to say. I did want to point out October Road. We are still looking for space. So they wanted to find space originally in Walnut Cove. When I drive through, I kind of look at some places. I did find something I want to talk to you about, but we do need to find space. I think we were looking at a bank, and I think the county ended up buying that, and so any help you can have on that would be great. So, and I just wanted to mention also the embedded care manager. That's a person who helps kind of, I guess, orchestrate the care in county. So they are someone who helps the DSS director, Stacey Elms, manage everything for the county, and she actually works, I think, 1 to 3 days a week in the DSS office. And then we're working to establish emergency respite beds with Nazareth, and we're working to find staff right now to be able to do that. And as you've probably heard, there's a staffing shortage in, I guess, our world, mostly in social workers. I know that there's a shortage in the county, in Stokes County, dealing with foster care. And so we're happy to help brainstorm on how to find, staff. I'm glad you mentioned Forsyth Tech, because we really want to try to be creative and working with the local community colleges, maybe trying to find some way on how to do some kind of tuition reimbursement for people. For example, if they came to work in Stokes County, maybe there's a way you can relieve some of that to find social workers, because it's very hard, and this is a statewide problem. I think that's it.
Can you introduce Derek and Laura
Yes.
to the rest of the board? I know
Yes.
Ronnie and Andy are online, but we can tell them what's going on.
Yes, well, for the Substance Use Committee, everyone voted on the leadership board, and they voted Derek Vickers as the chairman, Tamara Lilly as the vice chair, and Laura Bullens as the secretary, and they're doing a fantastic job. We had a really productive meeting with judges, 3 district court judges, a couple weeks ago, and really found out what their needs were, and they mentioned that they really are already doing a drug treatment court. They said it's just not fancy,
but they're
Right.
they're already doing that. And then they also said that recovery housing was their biggest issue because if they tell someone to get treatment, they really don't have anywhere to send them. So that was another big issue. But I'm really excited that they're doing this because it's a huge lift and it's really important for the community. So thank you.
Let me piggyback on that. So Derek works with Insight on the prevention side of things, and which we think is very, obviously very important. And Laura's our community paramedic, and Tammy, who couldn't be here today, works with Exodus Ministries, helping provide some housing for some sober living housing, and has been working in the communities for a good while on that end of things with the faith-based side of things. So I think a very well-rounded group of leaders there, and I'm excited about it, and I'm excited to, I think what this board needs to decide a few things, and one is about this committee. I think keeping it together is important, and maybe paring down. Like, there's been lots of meetings. I think I may have only missed one meeting since the board's, since this committee, or more like a study group initially, was put together. Different people have kind of come and gone, but I feel like there's a core group that has stuck together and has been vital to and instrumental in this study group. So if it's okay with the board, I think moving forward we might want to appoint these committee members and make it a little bit more official, because they would like to make some recommendations to the commissioners about how to spend that opioid settlement money, and which in their research what they found is needed and where the gaps are. Have you got anything else to add to that, Shannon or Eric or Laura?
I think you all just started out first more like a steering committee, like meeting.
Right.
Instead of just doing some brainstorming and ideas, and now it's turned into more of a formal group. I know you want specific people on that who are key players in, battling and combating it. You just don't want to appoint everybody to it. You need certain people in certain positions. So, but I do think it would be a good idea to make it
More formal.
If you're going to take action on things, you're going to make recommendations to this board on things about the funds that are coming in from that settlement and things like that.
Well, I think that would be this board can, decide. I think that seems like the direction it needs to move towards.
Yeah, and ultimately, you all are going to be the deciding factor, the
Right.
final word on everything. So
On the money and
that'll
everything.
be up to you on if you want to make it more of a formal committee on appointing them, or if you just want them to baptize them and just come in and make, as an advisory.
And we might need some attorney advice on which direction you think. I think we've got to consider the open meetings laws and things like that if we want to do things the right way, for sure.
Right.
So, and there's two, and Kara can speak to this, with the settlement money, there's a lot of guidelines of how that money has to be spent, so we have to follow that closely, and there's two, A and a B,
Yes.
that we need, and the commissioners ultimately will need to decide which direction we're going with that, and that gives this committee more direction.
Yes, and I guess, some counties do it, different ways. Alamance County does have a large committee that's appointed. I'm not sure if it's appointed by the commissioners or not, but, everyone's working through this money, and they want to make sure that they have all the experts at the table for it to go in the right place, because there is a lot of planning and there's a lot of transparency and accountability and reporting
Yes.
with whatever option the county chooses.
Okay, well, maybe at the next meeting, we can have more of that on the agenda, where we can actually look at those, and the board can pick where the focus needs to be with the money. It wouldn't be a formal recommendation on how to spend every dime of the money, but choosing which column, I guess, we're going to focus on.
Yes, yeah, that would be a great first step.
I need to go ahead and do that. Okay. Any other questions?
I have some.
Go ahead.
Thanks, Madam Chair. What's the October Road Clinic? What's the definition of that?
The October Road will be helping provide medication-assisted treatment. I don't believe that there's a Daymark did just start providing treatment, but there are a lot of different stipulations, like someone has to be completely detoxed. So on October Road is just another option. We have Daymark, I believe, in King, and we wanted to have another option for the county.
Was October Road, that's the name of it, or
It is, yes.
it's not like a November Road or?
No.
There's October Road is the name of the
Yes.
program or whatever.
Yes.
We're doing Matt stuff.
Yes.
So we've got that in place and we just need a space to do it, is that?
Yeah, they're ready. They're ready to go. So we just need to
Okay.
find a place that has good parking. And, they wanted to put it in Walnut Cove.
They want to lease some space, or is that what they're after?
Yeah, I think they want to lease.
How much, do you have any idea?
I think it's around 2,300 square
Okay.
feet would be ideal.
Okay. Okay, good. Back on chart number 9, let me ask you a quick question.
Okay.
We were talking just now about the substance use committee and so forth. You got that chart on number 9. It's got the 50% with a 40% goal, and then your other line across the top. What's that all mean about the goal and the 50%?
The goal is the state goal. These are state set mandates. So we usually perform above that goal at VIA. But
Okay.
that's the baseline.
Okay, so 40% is the minimum, and
Yes.
as long as you're above that, you're doing better.
Yes.
Oh, okay. Okay, and then the top line is your average across all your activities?
Yes, sir.
Oh, okay. Okay, the only other question I have is on the innovations waiver program with a waiting list, is the limitation a lack of funding for that, or is there some other control on it?
I think it's lack of funding and probably staff support too. I couldn't tell. I could probably find out how many people are on it now, but I would think it's a funding issue with the state. I would think it's
Okay,
pretty
is it funding that we should supplement locally possibly, or?
I don't think you can supplement it locally, but it's just to give you an idea. It could be up to $135,000 a year per person.
Oh, okay, to
So-
do that.
Yes. So that's why it's very expensive.
And are some of them a lot less than that though, or are they all about that much?
That's a good question. I don't know.
Okay.
I don't know what the average is. That would be good information to know though. I'll try to find that out.
But we have, this other funding, I forget the acronym for it, that Stacy budgets every year. What's that called? Yeah, the MOE funds. I mean, we should choose places to put that, so if we, yeah, that we have to do every year. So, I mean, we could look at maybe budgeting some of that for it if it was allowed, but if not, then that's a separate issue, so.
Well, Stacy is fantastic, I have to say. And we do work through the MOE funding with her just to see kind of what the plan is for it, because it could go from anything to, Narcan.
Yeah.
Last
Yeah.
year to look and make sure there was something that we weren't budgeting for that you might be able to cover. That
Yes.
would free that money up to use for other places.
Yes, like Narcan, because we can,
Exactly.
we
That's
usually,
$12,000.
Yes.
Yeah.
yes. So
It'd really be interesting to know do we know how many people are on our waiting list in Stokes County for the Innovations Program, or can we get that number?
I don't know if that was in that graph or not. Let me look.
I don't think so, but,
I think there's probably a lot of people that don't even know about the
yeah.
program, and I can think of a couple of people that are adults that are intellectually challenged, type autistic, whatever, that would be interested in. But like she said, it could take a long time to get on it. But
Yeah.
like I know, for instance, some people that I'm thinking of, their parents, they're intellectually challenged, like Down syndrome, autistic, that live with elderly parents that they're going to outlive their parents, of course, and their parents are getting up in their 80s, and I'm thinking, what's going to happen to these people when their parents are gone? And that would be a perfect fit for a few people that I can think of.
Well, I would definitely encourage them to apply. They can call the VIA hotline, and there are questions they ask, of course, and they'll have an assessment to know if they qualify. But yeah, it's peace of mind for sure for aging parents. I know a lot of parents will do a trust to make sure that care continues.
Mm-hmm.
But these are, Commissioner, those are Stokes County numbers. So you can see that that members on the Innovations Registry.
Yeah, which chart's that on number 6?
Yes, 6. So that light blue triangle, that's the people who are waiting.
Oh, okay, okay.
23 people.
Yes. And then, actually, sorry, no, we need to add those. So 23 people are getting extra services, like I mentioned, like respite care.
Okay.
And then the other 52 people in that orange block, they're not getting any extra
Okay, I
services. They're
see.
just waiting.
Okay.
Okay,
So the people who receive it right now are 50 people in the county.
okay. Yeah, we actually have 50 that get it.
Yes.
Okay.
Well, that's good to know, at least. Yeah.
Yeah, I'd be really interested in more information on that as we go forward.
Yes, I will.
Or we
will
might
have
get the other folks signed up.
that.
Maybe we can try to get push at the state level to free up some additional funding for that, because that's a pretty big need right there.
It is. It's a really big need, and something else that could be done is to educate the families who are waiting that maybe aren't utilizing those services, because that might be they might not understand what they are.
Right.
So
Medicare and Medicaid wouldn't pay for something like that, would it?
it is Medicaid.
Medicaid?
Yeah.
Okay.
Yeah.
So that's all ages then?
Yes.
Okay.
Any other questions?
That's all I have, Madam Chair.
Commissioner Nicholson, do you have any questions?
I don't. Thank you, Madam Chair.
All right. Commissioner Mendenhall, do you?
No, ma'am.
Okay. All right. You have any?
No, Rick asked me what I
All
was
right.
doing.
Thank you for coming and for the update, and hopefully at the next meeting, we'll get a little deeper in with the substance use committee and the opioid settlement money, looking at that a little deeper.
Absolutely.
Great.
Yep.
All right, thank
Thank
you.
you.
All right. That takes us to the discussion agenda, and we have Richard Brim here for the tax office agenda.
Good afternoon. Like always, to start off with the tax office collection status report. Pleased to report we've collected $14,982,000 so far in this fiscal year budget, or 57.85%. We're about $475,000 ahead of where we were last year at this point, so that's good. Next item is our quarterly discovery and garnishment report. Our office has discovered 130 accounts. That has generated $5,312 in additional revenue. Our collection department has processed 260 garnishments with a levy of $117,616. Moving on to our EMS billing and collections report, we have billed 987 transports so far this quarter and have charged $640,158, collected $494,747. With $146,899 of contractual obligations. Next item is our Datamax, our interstate collections report, NC debt set off. It's collected $10,059 in this quarter so far for this fiscal year. Then moving to our real and personal releases less than $100, we have 4 accounts that total $163.63. Refunds less than 100, there's 5 bills that total $313.21. Real and personal releases more than 100, there's 2 accounts that total $345.79. And then the final category is real and personal refunds more than 100. We have 9 accounts that total $1,932.52. We will have 1 late application for elderly exemption and 1 late application for use value. That's all I have.
All right, thank you. Any questions?
None for me.
Well, thank you. Appreciate it. Good report.
Just ask if we could move the real and personal releases and refunds more than 100 and the elderly and use value late applications to the November 14th consent agenda.
We'll do it.
Thank you.
Thank you.
Thank you, Richard.
All right, the next item is the Board of Commissioners meeting schedule for 2023.
So what I'm presenting here is, like you said, the 2023 Board of Commissioners meeting schedule. All of the dates listed on the proposed schedule follow the board rules of procedure, following the second Monday and every fourth Monday of every month. So 6 o'clock for the second Monday, and on the fourth Monday it's at 2 o'clock p.m. So all of those dates reflect that. And like I put in the agenda, it's noted and understood that the scheduled first regular meeting in April is on Easter Monday. So if it's up to the board and they want to move that, that's certainly okay. We just need to make that change. We can just move it to the next day, which is Tuesday, April 11th.
I think
Or unless everybody's okay.
schools are in, I'm pretty sure.
We're
and
open. Yeah, we're
they're
open,
open, so
right.
I don't see a problem keeping it on.
Well, I just know, I know last year we were doing the schedule for the equalization and review. We had moved it from Easter Monday, that date. But, and then the planning meeting dates are also available on the next page for the commissioners as well. And I double checked with planning director David Sutterth, and he confirmed those are the dates he had for next year as well.
Do I have any board members that want to move the one on Easter Monday, or just wait and see? I guess it can be moved at a later date as well,
Yeah, we'll just have to advertise.
if we change
We'll just
it.
have to advertise it again if we do change it.
I think everybody used to Easter Monday was a much bigger deal, I guess, to be off, but now it doesn't seem to be.
I think historically we've moved it, but when you do that, then it creates some confusion sometimes, so I don't feel strongly one way or the other.
I say just leave it for now. If we see it's going to be a problem later on, we can move it.
I'll just have it on action for the next meeting.
All right, thank you. All right, Lisa Lankford was going to talk to us about the accounting software conversion. Right.
I just wanted to give an update where we were. I have attached several counties that we inquired their likes and dislikes and what software services they were using. Tomorrow we have a phone call with IT and Tracy and myself with Jim's to discuss some of the, there's a couple issues with the contract that we wanted to talk through. And Ty had a question as far as liability. So hopefully, we get all those ironed out, we'll be ready to get started.
All right. You have any questions?
I have a couple comments,
Okay.
right, I do. We talked about this a little bit before, and I discussed it with Lisa before the meeting today. I think they did some really good due diligence work on here, looking at the other system and then the one that they're recommending that we purchase. I think all this data on these two sheets illustrate how difficult this is going to be, even with the ones that like are going with the company we're looking at. They have a concern or two as they're going through the process. So I think we're probably, I don't have any reason not to go with that company that they're recommending, but I would like, before we sign a contract with them, to have them come and give us a presentation, or either do it over the Skype or whatever system, where we could the board could directly ask them a lot of questions about all this. Because no matter which one we pick, it's going to have a lot of challenges. It's heavily involved with IT, and Lisa and Diane are working really close together to make sure that the IT issues get solved. But there's been a few, like from the pandemic, that went through some real challenges with this, and even in good times, it'll be a very hard transition to make, I think. So one advantage is Ashe County's doing it, and so it looks like they're doing it kind of about the same time as us. So it looks like we could probably confer with them as we go through the process. And then there's 3 other ones on here in other states that we could also continually talk to make sure that we try to learn lessons from each other, because this is a really big deal, putting in a new software that's going to do all this stuff. I mean, the whole county runs on it, basically. So, but I'm good with that, if we can maybe just get these guys to give us a presentation. The other thing is too, I assume Nick and Ty can look at this, the scope of how much this costs. I don't remember the cost, but something this big, I don't think we have to do a competition unless we already have like a solicitation and whatever. But I think with a service thing like this, you don't have all those restrictions. That'd be something to check out and make sure we're clean on that as well. That's all I have, Madam Chair.
All right. I just think that this group, gyms, we're just going to need a lot of IT support from them on their side. And like Commissioner Morris was saying, having their, sort of having them to present to us to show us like what they are going to be able to help us with and assure us of their availability to quickly solve issues that might arise is going to be pretty huge, because it does look like quite the undertaking, especially just the transition and getting all the bugs worked out. I just anticipate it will be quite the undertaking. So I would be wanting their assurances as well.
Yeah, and I mean, we're transitioning to a new finance officer at the same time we're doing this, so it's one thing we'll have to just watch closely and make sure that we are responsive if any issues come up from the board that board needs to help with.
Advertised for another position. We lost a position in IT, which we've not filled because of the lack of qualified applicants.
Mm-hmm.
It might be something we want to think about re-advertising and trying to get some more help. Or sometimes, though, bringing on a new person to try to train in the middle of all this might not be the best idea. So I don't know, but certainly something you can get Diana to give you some feedback on.
And that position is posted until filled, so it's just out there.
Oh, it's still out there?
Yeah, it's out there on the website, so if you know anybody interested in applying for the IT position.
Yeah, one of their due diligence things said something about having a full-time IT person on this or something, or maybe just during the transition, I think, or.
It probably wouldn't be a bad idea if somebody was just dedicated to it during the transition.
Yeah,
Yeah,
we had to contract for somebody or something.
that's true. Commissioner Nicholson, do you have any questions?
I don't. Thank you, Madam Chair.
Commissioner Mendenhall, do you have any questions or concerns or comments?
No, I don't have any questions. I'm in concurrence with you, Madam Chair, and also Commissioner Morris as far as getting the group to come out and give a presentation. And that way, I think if we have any questions that pops up during that, it would be to our advantage for them to come out and do a presentation.
All right. You have any questions? All right. Thank you, Lisa. We appreciate the update. The next item is, Lisa as well, the audit contract amendment request.
We were supposed to have had everything finished to the auditors, and they were to be finished by October 31st. We haven't got everything to them, so they want to amend the contract for the audit to January 31st. Which doesn't mean that the audit will not be finished until January 31st. We just can't get everything by Monday to them. So I'll have the amended contract for you to sign.
Okay.
Everyone.
Is that something we need to move to action? Or just,
Yes. Please.
Yeah, I would think
all
so.
right, so that needs to be action item C is the audit contract amendment request. All right, we'll move
I
that.
think it has to go to the LGC, right, Lisa, for approval?
After it's signed.
Yeah.
And they'll send it to.
I'd be interested in what their feedback is whenever they approve it, what the LGC says.
Like you said, you don't need till January, you just need more days than Monday. Okay.
Right, but there was an extension to the audit contract just, was it last
Last
year?
year.
When Julia was still here, they had to do the same thing.
Mhm.
Yeah.
They weren't quite ready to be.
Gotcha. Hand it over. Okay. All right, we'll move that to action today. And the next item on discussion is E, the Fire Commission appointment request, and Amber has that.
there are 2 vacancies right now available for the civilian positions on the Fire Commission. These positions were advertised on our website and I guess by word of mouth for several months with no interest received. I received no applications for these positions. And the individuals currently holding these positions are willing to take on another 2-year term. And those individuals are Robert Knight and Steve Fagg, and they're both being recommended for reappointment. There's also 1 vacancy for the fire service position on the Fire Commission, which is Stephen Roberson, and he's currently serving in this position and is willing to take another 2-year term.
Okay. Do we have any questions, or do we want to just move ahead with, I'll open the floor for any further nominations.
I don't have any further.
All right. Then I need a motion to nominate these individuals and close the floor. So I need you to nominate.
Yeah, I make a motion to close.
All right.
No nomination.
Second.
All right. All in favor?
Aye.
Aye. So we have Knight, Fagg, and Robertson for,
Fire Commission.
okay.
And I will request that this item be moved to today's action agenda just because it has already been advertised. And the Fire Commission requested this as well, just because the term dates end on October 31st, and they want to make sure that these
Okay.
are reappointed by that date.
Okay. Do I need to do anything else right now, or just move it to action?
Just move it to action.
Move it to action. Item D, Fire Commission appointment request, item D. Okay. All right. Then item F is the resolution supporting building reuse grant on behalf of the Mitchell's Meat Processing. We have Nick here for that.
Afternoon, everybody. This is probably goes right along hand in hand with your action agenda item A. So the resolution that you signed before gave support to this process. Now that you've held the public hearing, this resolution finally actually approves the county taking on this burden, and it authorizes the signing of the contract with Mitchell's Meat Processing. So this resolution should technically, I think, be moved to action A and signed or approved before the agreement itself is approved and then signed.
So I need 2 action items on this. I mean,
Well-
I need an additional action item before the proposed economic development incentive. So this one, the resolution supporting the building reuse grant, will become A now.
Yes, please. And you'll notice that the only difference in the language is it clarifies that the actual hearing occurred on October 10th and that the statute allows this to move forward after that public hearing. Authorizes the board to sign that agreement.
Okay, are there any questions for Attorney Nick Overby about the resolution?
Done.
All right, then it'll become action item A. And the next item is action item A. So, do I have a motion to approve the resolution supporting the building use grant?
Motion.
Second.
All those in favor?
Aye.
Aye. All right, and Andy's an aye, and Ronnie's recusing. Then item B is the proposed economic development incentive arrangement between Stokes County and the Mitchell's Meat Processing. Do I have a motion?
Motion to approve.
Second.
All those in favor?
Aye.
Aye. All right, now, C is the proposals for the hospital needs assessment feasibility study. And we had a couple, we had narrowed it down to a couple of proposals. Glenda's going to come up and talk about this for a second. Thank you, Glenda.
You're welcome. I was hiding in the back. Shannon and I have been in discussion on these for the last couple weeks, if not longer at times. And we are both in agreement and would like to give our recommendation as to move forward with recommending the HFG group, which is the Health Facilities Group. We just felt that this group was the best out of the proposals submitted. They had a lot of experience in kind of what we were looking for, rural health, USDA. They actually had some background in doing some different things in hospitals. One of them, their examples was they had used one of the spaces for their physical therapy. It actually made it into like a wellness center, I guess for say after hours or something. I thought that was kind of interesting. And then they use their cafeteria as like a cafe. So that to me was kind of, well, they kind of look outside the box, even though we're looking for healthcare. It did make that. And then we felt that their time frame was very reasonable, their price was very reasonable. So that is our recommendation, that we would like to proceed with awarding the contract to them if you all are in agreement.
Okay. Any questions?
I looked at it again and agree even more than I did last time that this is the right choice, and I made a whole list of reasons, but I won't go through them unless you guys want to hear them.
I'm looking at those two that we kind of narrowed it down to. I think they do make the most sense. They have a lot of experience, which is good, and I feel like we could trust them to give us some good recommendations. So I'm fine with that group.
I felt like they offered more.
Commissioner Nicholson, do you have any questions or comments about it?
No, I just agree with what all's been presented and recommendation.
All right, Commissioner Mendenhall.
Thank you, Madam Chair, for remembering my last name.
It took me a minute, sorry.
I'm going to have to put that on my forehead.
I'm just messing with you.
But I'm in agreement with the health facilities group also. I looked over it, and I think they, as you said, have a lot of experience, and I think they do a good job. So I'm in agreement with the group.
All right. Well, that being said, I'll just get a motion to HFG to be the recipient of the RFP for the feasibility study. I need a motion.
Motion.
Second.
All those in favor?
Aye.
Aye. All right, tell them to get to work. Go ahead. All right. Let's see. So item D now is the audit audit contract amendment request. Do I have a motion?
Motion to approve.
Second.
All those in favor?
Aye.
Aye. Okay. And item E would be the fire commission appointment request. And I don't have to open the floor again.
If you will, just poll the board.
Pull the board on Knight, Fag, and Robertson.
Knight, Fag, Robertson.
Knight, Fag, Robertson.
Andy?
Names recommended.
All right. Ronnie?
The three that are listed that has been mentioned, I'm in agreement with those.
All right. All in favor? Okay. Did I get a motion to approve? I don't think I did.
That's okay, since you pulled the board and they
Okay.
already amended.
All right. Good deal. All right. Is there anything else? We don't
Make a
have
motion, we adjourn.
All those in favor? Aye. We're adjourned.
Thank you.
Thank you. Ronnie ain't gonna miss